The U.S. Food and Drug Administration will be asked to approve MDMA, yes, the illicit drug. They're expected to approve the MDMA to treat post-traumatic stress disorder by October of 2023, opening the door to the use of hallucinogenic drugs to treat mental illness. If approved, the drug will be available in hospitals before the second half of next year, according to new research. MDMA, also known as ecstasy or Molly, is a popular drug in rave culture, with people taking it to connect with the music and dance the night away. However, that's the article. I didn't make that up. However, a 2021 clinical trial for the nonprofit organization Multiple Disciplinary Association for Psychedelic Studies showed that out of the 90 people who suffered from post-traumatic stress disorder, those who took MDMA paired with psychotherapy were twice as likely to recover compared to those who did psychotherapy with a placebo, according to the journal Nature. That's all we need to read of that. I just want to start out by going, how many people do you think were tricked by the placebo into thinking that they actually had taken MDMA? I'm going to go with zero.
Zero.
Yeah.
That's where, blinded studies, 2 of them, I believe, are required by the FDA, at least 2. And it's impossible to blind in something like this.
That's a funny, I mean, I know they have to do it, but I can't imagine somebody takes a pill and then just lays there thinking it's going to hit any minute now, right?
Yeah. And then the other thing is bias of people who want to be in the study.
Right.
Probably are going into their therapy session a little upset they didn't get it because they know they didn't, or, ready to kind of, raring to go, so to say, because they got it and they wanted it. And, that's why they entered this study. So I think there's that difficulty too.
Those are the negatives. Let's talk about the positives first before we get rid of all of this.
Definitely.
What is PTSD?
So in a nutshell, PTSD is a mental health problem, obviously, but it develops after experiencing or witnessing a life-threatening or traumatic event. So, I think it's pretty obvious, from that standpoint, it's a lot of people coming home from war, or they have these obvious, traumatic events that have happened to them as children, or, as later in life, or whatever the case may be. So if the symptoms last, obviously, sadly, a lot of people have gone through things like this, but if the symptoms last for more than a few months, then it may be classified as PTSD. This includes vivid flashbacks, intrusive thoughts of the action, nightmares, waking you up in the middle of the night about the issue, distress at any reminder or any symbolic reminder of the trauma. And then there's even just physical manifestations, nausea, trembling, sweating, things like that, where, there's chemicals in your body doing things that you're not realizing, but you've been triggered by a memory or a symbolic, event. So,
so not just normal stress,
right?
There's a normal stress response. This is for folks that it's been ongoing for months and years.
Correct. Yeah. And there's a clear source of why. This is not a chronically stressed person or, a person who's had a few bad relationships. These are major events.
Like war.
Yes.
Makes sense. But I mean, come on.
Abuse, things like that.
Street drugs for the mentally ill. This does not seem like that's always what I was told, is that they were self-medicating and that's a bad idea. So now we're just helping them with that? Is that what's going on here?
Well, I mean, that's definitely an interesting point. I think that for anybody that's read or heard about the How to Change Your Mind book, Michael Pollan, which is interesting. It's been a few years since I read that. My biggest takeaway at this point, after not having looked at it for a while, was just sort of the destigmatization of all of those sorts of medications. The, marijuana use, psychedelic use, the potential benefits of psychedelics. I think a lot of us, that's our reaction. Yeah. And I'm not saying that like I really have a strong opinion one way or the other with it at this point.
Right.
But I think that the stock opinion is just that the misuse over time, and I know that's more, talking psilocybin and LSD and what, all that end of the spectrum.
Right.
I think it's hard to still undo a lot of that. You picture the 60s,
right?
60s and 70s, and you have a hard time dissociating that part of it. But there's certainly merit, biochemically at what's happening at the level of the brain and why this makes sense and why this has potential utility for some people. But I think it's going to continue to be trial and error over time. There's still not really a whole lot of long-term outcome data because, again, the stigmatization prevented a lot of these trials that were occurring way back to not even really get off the ground. And so finally it's starting to ramp up again.
Am I right in remembering that the history was something along the lines of in the 40s and 50s when these molecules were discovered, there was some legitimate research being done on them, and then things got way out of hand. Sure. And because there's no laws against it, so it got way out of hand. They put a bunch of laws in place and just said, stop it. Nobody can touch it. Don't even think about it.
Yeah.
And they're starting to relax that now and go, okay, well, maybe in clinical situations, there's a reasonable use case for this.
And then specifically here, part of the problem that I see is that MDMA has, because it's used at clubs and raves,
right?
It's really, it's to kind of get that, you can have that feeling of like camaraderie with people that you're around. It is kind of stimulating, but it is kind of releasing serotonin. We'll get to that.
Yeah.
But it's really like, it's the sensations of light and sound. It's not, my point is, it's not a hallucinogen, and it's gotten lumped in because because it's like you're saying, the chemical structures, these chemicals were found similar time. This one actually was discovered in 1912, but its studying was,
right.
It was around that time. So it's gotten lumped in. Even the society or the organization that's doing the studies has the word psychedelic in there.
Right.
This is not a psychedelic drug to me. Yes, it increases a little bit of your perception of music, noise, and sound, but it's not a psychedelic. When you start looking at LSD and psilocybin, almost you're entering in like this alternate reality. You are off planet Earth. If you try to talk to somebody,
right.
It's a totally different thing to me. It's a psychoactive drug.
Right.
It is not a psychedelic drug to me. So, I'm just starting there in my opinion.
Sure.
These drugs are very different from each other, even in their own little category, which I think is flawed. Secondarily, and this would to me apply to the LSD and psilocybin as well, but they are drugs heavily abused,
right,
with an extreme abuse potential, but not an addiction potential.
Okay.
You can be psychologically addicted to anything, to food, to gambling, okay? So yes, if you take this and you really like it and it's something that you've latched onto, yeah, it can happen. I'm not,
sure.
I want somebody to send this nasty email about, a relative that's okay. But in general,
right,
when you're comparing Schedule 1 or Schedule 2, the most controlled medications or chemicals, you're talking cocaine and heroin and oxycodone, legal drugs.
Yep.
Okay. And some of them legal, obviously, and you're comparing them, their addiction potential, the process
physiological
of,
addiction.
Yes. When I start taking this, both psychologically and physiologically and physically, I'm going to have a really hard time stopping. When you compare those types with the LSD types and the MDMA types, to me, you're in a whole different ballgame.
Okay.
Again,
Fascinating.
both very high abuse potential. Only one of those categories to me, and I think it's pretty documented, has high addiction potential.
Okay, so that is a little bit of apples and oranges, and it's fascinating because we do already have all those drugs that you mentioned that are fully legal, and obviously we have lots of ramifications and problems with them now. But
yes,
we're not
exactly.
We're not adding to that with this. This is a different animal, so to speak.
And I want to be clear, if you take too much of this, if you drink way too much water with this, if you are buying it on the street and you're getting adulterants in there, I am not saying that this is just something you just, this is like some wrongfully coded drug. I'm not saying that. I'm going down the line, first comparing it with other psychedelics, then comparing it with other drugs in similar control categories.
Got it.
And that's, again, there's certainly, very concerned about people getting this on the street and what the manifestations of that can be. And also, yes, if you are taking this very often, they've even found potentially that there are chemical changes in the serotonin receptors and in parts of the brain. So this is a heavy drug. Let me make that clear as I've kind of talked it up, so to say, over the last few minutes.
Yeah.
Let me make that clear before, we go on.
And nobody is suggesting, the article isn't even saying that you'd get a prescription for this and then you'd go home and take 2 in the morning every day for a month.
Exactly. These are therapy assisted drugs as the same. We've seen this with psilocybin, and maybe we'll talk about that one too. There's gonna be some similarities, but these are done in sessions. I believe this study there were 3 sessions with very little dropout, which is interesting. Again, I still would like to see. I'm assuming that the people who signed up for this wanted to be in this, but may not just be for reasons if they wanted to try the drug. They may be really suffering.
Yeah,
I mean,
if you got PTSD,
I was going to say they are really suffering.
Yeah. So how does it, without getting too granular, how exactly does this work? I mean, it's not just that people are getting high and then they feel better. You said it's with therapy, right?
Right. So one way addiction, the tie of it, all addictions, food to gambling to heroin to cocaine, is dopamine. That's the reward chemical that ties in everything. People getting addicted to running or whatever. I mean, that's how that's kind of the tie in. So something like food is not directly releasing dopamine. It's your body's response is to release some dopamine. But when you take a drug like cocaine, or in a mild form like MDMA, you're literally biochemically releasing dopamine.
Okay.
And so that happens more in certain drugs than others. So there's a mild case of that here with MDMA, but it's much more focused on serotonin. That's where you get kind of the feel good, the camaraderie type thing. It's a serotonin.
It's a bonding drug, right? Or a hormone, right?
Yes. So what it does, so if you compare it to, which I think is important, to an SSRI, serotonin specific reuptake inhibitor. So what that's doing is whenever there's 2 neurons trying to talk to each other, and it releases serotonin, it kind of leaves it in that talking form instead of bringing it back.
Okay.
But it's not making it release anymore. It tries to make it a little more effective. Okay. Well, MDMA does that and also dumps serotonin.
So it does both.
It does both.
Okay.
So that's why, what's the difference? Well, you're saying all this, then what's the difference between that and my Prozac? That's the difference. There's a dumping of serotonin. So then what also can come with that is, after effects, especially at higher doses, you can feel a little down. You can feel a little dragging, a little bit, little anxiety. Those kind of things come with it. Again, it is a heavy drug.
Yeah.
So we've talked a little bit about the dopamine. The main thing is the serotonin. And then thirdly, it does hit norepinephrine, which is, kind of that stimulant, one of the stimulant neurotransmitters. So it hits some of that as well. So you do get that little bit of energy that kind of can, again, why it's associated with some of the club stuff and rave stuff.
So is the thinking then that people are taking this and in therapy sessions, they're getting those positive hormones and they're able to more safely, emotionally safely, they feel more stable in exploring and going through the trauma that's happened?
That little bit of that neurotransmitter norepinephrine release that can be almost anxiety inducing is way overridden by the intense serotonin release. Okay. Because what happens is whenever you're talking about these awful traumatic events, your body goes into fight or flight mode.
Got it.
So it's all of your excitatory neurotransmitters firing, and your inhibitory ones like serotonin and GABA are not firing. So you take this and you start firing these inhibitory ones to go along with the natural response that you're having of the fight or flight ones. And that's where it allows people to make sense to have more of a productive therapy session.
Got it. That makes sense. And that helps me to clear it up. It's not just a bunch of people that want to get high and are doing it for fun. So
They say in general with treating PTSD, it's best treated when a patient's in the quote unquote optimal arousal zone. And so they say this is the zone in which emotions are engaged, yet not overwhelming. In this zone, 4 symptom clusters of PTSD are sedated. And so people are re-experiencing, they're avoiding negative alterations in cognition and mood, alterations in arousal and reactivity. So something that lowers all of that stuff and allows somebody to enter what they call the optimal arousal zone a little more readily because its ability to increase empathy and closeness and all that kind of stuff. And I think that's why they lump them all together, just because of those properties. But yes, if you start pushing the doses and doing different things with them, you're dealing with much different effects.
Right. So this is not something that a doctor is going to, even if it's approved by the FDA in October, This is not something that the doctor is just going to write a script or a psychiatrist and bring it to you guys at the medicine shop and somebody's going to go home with MDMA.
No.
Okay. All right. I guess the only other question I would have is, if these are so effective, why haven't we been trying it before? Is it the historical reason?
Yeah, definitely.
The scheduling,
Yeah.
the Schedule 1 nature of these drugs or whatever, Schedule 2, the stigma, that kind of stuff has made it incredibly difficult to study. Nobody was funding them. And if you started to touch this stuff, then you're like the old guys. Yeah. So it's tough. You know, it is really tough. Who would want to put their hands on that stuff?
Exactly.
At that point?
And largely because you can't patent it.
Yeah.
Because it's been around since 1912. They cannot patent it. So yes, there can be some lucrative clinics and some well-meaning people and these organizations that kickstart this kind of thing, but there's not billions of dollars of profit behind it by an individual entity that's going to, for all intents and purposes, ram this through.
Right.
Ram this home. Yeah.
The capitalist element of this is kind of diminished.
Yes.
Fair enough.